Comirnaty concentrate for dispersion for injection. COVID-19 mRNA vaccine nucleoside modified. A guide to product handling, preparation and administration at your vaccination site. Training for healthcare professionals and other relevant decision makers in Great Britain. Comirnaty COVID-19 mRNA vaccine nucleoside modified was previously called COVID-19 mRNA vaccine BNT162b2 and supplied under a Reg 174 temporary supply authorization. Following conditional marketing authorization, the vaccine is now known by the brand name Comirnaty. This medicinal product has been authorized under a conditional approval scheme. This means that further evidence on this medicinal product is awaited. New information on this medicinal product will be reviewed at least every year, and the product information will be updated as necessary. This medicinal product is subject to additional monitoring. This will allow quick identification of new safety information. Healthcare professionals are asked to report any suspected adverse reactions. Comirnaty is indicated for active immunization to prevent COVID-19 caused by SARS-CoV-2 virus in individuals 12 years of age and older. The use of this vaccine should be in accordance with official recommendations. If you are concerned about an adverse event, it should be reported on a yellow card. Reporting forms and information can be found at https://coronavirus-yellowcard.mhra.gov.uk/ or search for MHRA Yellow Card in the Google Play or Apple App Store. When reporting, please include the vaccine brand and batch lot number if available. Alternatively, adverse events of concern in association with Comirnaty COVID-19 mRNA vaccine nucleoside modified can be reported to Pfizer Medical Information on 01304 616161 or via www.pfizersafetyreporting.com. Please do not report the same adverse events to both systems, as all reports will be shared between Pfizer and MHRA in an anonymized form, and dual reporting will create unnecessary duplicates. When you receive your delivery of Comirnaty, it will be important for you to follow appropriate steps for the handling, preparation, and administration of the vaccine. Practice good hand-washing technique throughout. Comirnaty should be prepared by a healthcare professional using aseptic technique to ensure the sterility of the prepared dispersion. All those attending for vaccination and those delivering vaccination should wear appropriate personal protective equipment, PPE, as described in the Infection Prevention and Control (IPC) advice current at the time of administering the vaccine. In this chapter, we will review what to do when you receive the thawed vaccine stored at 2 to 8 degrees centigrade. Labeling on the pack will contain the name Comirnaty concentrate for dispersion for injection, and labeling on the vials will contain the name Comirnaty sterile concentrate. You will receive packs of 195 thawed vials stored at 2 to 8 degrees centigrade. These are multi-dose vials containing 6 doses that must be diluted before use. Check your record to ensure the vials are within the thawed vial shelf life requirements, which is 1 month shelf life at 2 to 8 degrees centigrade. Within the 1 month shelf life at 2 to 8 degrees centigrade, up to 12 hours may be used for transportation. Store undiluted multi-dose vials in the refrigerator at 2 to 8 degrees centigrade. Store in the original package in order to protect from light. If you are handling Comirnaty in its frozen form, please refer to the instructions later in this video in Chapter 4. During storage, minimize exposure to room light. and avoid exposure to direct sunlight and ultraviolet light. Thawed vials can be handled in room light conditions. Once thawed, the vaccine should not be refrozen. In this chapter, we will explain how to prepare the vaccine. Comirnaty should be prepared by a healthcare professional using aseptic technique to ensure the sterility of the prepared dispersion. Allow the thawed vial to come to room temperature, up to 30 degrees centigrade, and gently invert it 10 times prior to dilution. One inversion means turning the vial upside down and back again. Do not shake. Prior to dilution, the thawed dispersion may contain white to off-white opaque amorphous particles. Remove the cap and, using aseptic technique, cleanse the vial stopper with a single-use antiseptic swab. Allow to air dry. The thawed vaccine must be diluted in its original vial with 1.8 milliliters sodium chloride, 0.9% solution for injection, using a 21 gauge or narrower needle and aseptic techniques. You may feel some pressure in the vial as you add the diluent. Ensure vial pressure is equalized by withdrawing 1.8 milliliters air into the empty diluent syringe before removing the needle from the vial. Gently invert the diluted dispersion 10 times. One inversion means turning the vial upside down and back again. Do not shake. The diluted vaccine should present as an off-white solution with no particulates visible. Do not use the diluted vaccine if particulates or discoloration are present. The diluted vials should be marked with the appropriate date and time. After dilution, store at 2 to 30 degrees centigrade and use within 6 hours, including any transportation time. Store diluted vials separately from any undiluted vials to prevent either accidental administration of the concentrate or accidental redilution of an already diluted vial. Do not freeze or shake the diluted dispersion. If refrigerated, allow the diluted dispersion to come to room temperature prior to use. After dilution, the vial contains 2.25 milliliters, from which 6 doses of 0.3 milliliters can be extracted. Low dead volume syringes and/or needles should be used in order to extract 6 doses from a single vial. The low dead volume syringe and needle combination should have a dead volume of no more than 35 microliters. If standard syringes and needles are used, there may not be sufficient volume to extract a 6th dose from a single vial. Each dose must contain 0.3 milliliters of vaccine. If the amount of vaccine remaining in the vial cannot provide a full dose of 0.3 milliliters, discard the vial and any excess volume. Do not pool excess vaccine from multiple vials. Discard any unused vaccine within 6 hours after dilution. Chemical and physical in-use stability, including during transportation, has been demonstrated for 6 hours at 2 to 30 degrees centigrade after dilution. From a microbiological point of view, the product should be used immediately. If not used immediately, in-use storage times and conditions are the responsibility of the user. To prepare an individual dose, take the diluted vial and, using aseptic technique, cleanse the vial stopper with a single-use antiseptic swab. Allow to air dry. In order to minimize the risk of stopper coring and black particles entering the vial, the needle must be inserted vertically through the center ring of the vial stopper. It is important that the needle is not twisted or rotated once inserted. Vials must be visually inspected for appearance and particles before and after dilution and each time a dose is drawn up. Do not use the diluted vaccine if particulates or discoloration are present. Withdraw the required 0.3 ml dose of diluted vaccine using an appropriate sterile needle and syringe. Adjustments to remove air bubbles should be done with the needle still in the vial to avoid loss of vaccine. Do a visual inspection to verify the final dosing volume of 0.3 ml. In this chapter, we will review the administration of the vaccine. Prior to administration, remember to adhere to normal standard of care and aseptic techniques. Comirnaty should be administered intramuscularly after dilution. The preferred site of administration is the deltoid muscle of the upper arm. The vaccine should not be mixed in the same syringe with any other vaccines or medicinal products. Comirnaty is administered as a course of 2 doses, 0.3 ml each. It is recommended to administer the second dose 3 weeks after the first dose. The use of this vaccine should be in accordance with official recommendations. Complete the patient vaccination card. Ask the patient to keep the card safe and bring it to their second appointment. Discard any unused vaccine within 6 hours after dilution. Any unused medicinal product or waste material should be disposed of in accordance with local requirements. In this chapter, we will review how to handle the vaccine in frozen form and the correct storage of the vials. Appropriate protective clothing should be worn while handling frozen vials. You will receive the undiluted Comirnaty as packs of 195 multi-dose vials that are already thawed and stored at 2 to 8 degrees centigrade. However, it is useful to know how to handle the undiluted vaccine if you receive it frozen. Store undiluted frozen vaccine in a freezer at -90 to -60 degrees centigrade. Within the 6 months shelf life, unopened vials may be stored and transported at -25 degrees to -15 degrees centigrade for a single period of up to 2 weeks, and can be returned to -90 degrees to -60 degrees centigrade. Using the pack label, record the expiry date of the thawed vials, which is 1 month after the vials were taken out from the freezer. Ensure this label remains with the thawed vials at all times. The multi-dose vial must be thawed prior to dilution. Frozen vials should be transferred to an environment of 2 to 8 degrees centigrade to thaw. A 195 vial pack may take 3 hours to thaw. Alternatively, frozen vials may also be thawed for 30 minutes at temperatures up to 30 degrees centigrade for immediate use. Once a vial is removed from the vial tray, it should be thawed for use. The unopened vials can be stored for up to 1 month at 2 to 8 degrees centigrade. Within the 1-month shelf life at 2 to 8 degrees centigrade, up to 12 hours may be used for transportation. Prior to dilution, the unopened vial can be stored for up to 2 hours at temperatures up to 30 degrees centigrade. Once thawed, the vaccine should not be refrozen. For more information about Comirnaty, please refer to the summary of product characteristics. Further information and resources can be found on www.comirnatyeducation.co.uk.